Good evening, and thank you everyone for being a part of our virtual seminar. Today, we're going to discuss the most common winter sports injuries and different treatment options. And we'll go over some of the different types of treatments, the most common injuries, as well as the treatments. According to some research, there's approximately 3.8 million people that suffer a winter sports injury, and that was back in 2013 in the United States alone. Some of the most common activities and their associated injuries are here. Several types of skiing, snowboarding, snowmobiling, sledding, not to forget hockey and ice skating as well. And we'll discuss some other ones. Starting at the ankle, mild sprains need little more than an ice pack or elevation, where fractures may need a cast or surgical intervention. And the ankle injuries usually happen from a twisting motion, whether that's your ankle twisting in or rolling on itself, or being planted in the rest of your body twisting. And those are the ones that typically cause more the fracture patterns. Some ankle injuries specific to snowboarding are what's called the snowboarder's ankle, where you get this kind of impaction injury through the boot. And this can result in the talus fracture. The talus is the articulating bone of the foot in relation to the tibia and the fibula on the outside here. And this is kind of on the outside of the ankle. So you'll see quite a bit of swelling, and depending on if that piece breaks off, that's what typically will determine if you need surgical intervention or if it's something that can just be treated in a cast. This was a young lady that I saw 2 weeks ago who was sledding, and her leg got caught on a stump. And so she fractured both her tibia and fibula there. You can see she still has open growth plates. And being 12, we were able to place this into a cast. We actually just saw her back today, and this talk was already made. Otherwise, I would have included some other updated x-rays that already show healing just because she's so young. An older person may have been a higher traumatic injury and they may have needed surgery, but often in a case like this where everything is lined up well, we can treat this in a cast for about 4 to 6 weeks, depending on the age of the person and the healing that we see in subsequent office visits. The knees absorb most of the shock to the body during everyday activities. These are also common in winter sports injuries. And typically, this is a skiing example, but they can happen from a hyperextension injury where you're go off of a jump and your legs go backwards. There's valgus injury in B is when your leg gets twisted out, and that can also happen from a twisting injury. Or if you get into this deep flexion bend, that's where you can start to see some quadriceps or patellar tendon injuries as well. And this is a young person that I treated about a month ago who had a very bad skiing injury where his leg hit one of the poles. He was doing some jumps and he tore his ACL, which you can see on the left picture here, and then tore his MCL right in the middle. And so he needed surgery for that because of the multi-ligament injury. You can see here on the left side, this was actually his medial side or the inner portion of his joint. And this was all of the capsular tissue, the lining of the joint and the deep MCL that was torn. And this is a huge gap that's there. That should not be there. The gap, this bottom part of this meniscus should be about down here. But this was such a significant injury. It was gapping wide open. So his knee was very unstable. Now, the good thing is, although his ACL was torn, it was only torn at the top side of the femur, femoral attachment. The bottom side is the tibial attachment, and that's our probe testing it. And because we have new techniques now, we're actually able to repair his ACL and create a healing response using his own tissue, whereas previously we would have to actually remove all of this good cartilage and good tissue and replace it with a different form of reconstruction. But these new techniques allow us to do repairs now, which actually accelerate the rehab. Now, the shoulder joint can also get injured. There's two main joints in the shoulder. One is the glenohumeral joint where the ball and the socket is. And the secondary joint is the AC joint, the acromioclavicular joint, where the collarbone meets the shoulder blade or the acromion. There's also the four main muscles of the shoulder, which is the rotator cuff muscles. These are commonly a common injury as well, just in kind of wear and tear and day-to-day activity. But one common injury from a bad fall on the shoulder is the shoulder dislocation. And that could go either out the front or out the back. You can see that in this x-ray image on the bottom here. And so this is something that does need immediate attention. And often, especially if you're skiing out west, they'll often have the medical tents right there on site where they can perform the reduction and get it back in place. So because the shoulder joint is more mobile, it's also less stable. And so a hard fall or traumatic injury can cause a dislocation, which will lead to tearing of the ligaments. Once the shoulder is located, we'll see folks back in the clinic and kind of reassess their stability. It may be that you have to be in a sling for several weeks to let everything scar down. And then we reassess it and see if any further imaging, such as an MRI, is needed. And if there continues to be instability or you feel like the shoulder is popping in and out of socket, those are the patients that will need further surgical stabilization. The AC joint, as mentioned before, can be hurt as well. It's usually from a direct impact onto the front or the side of the shoulder, and it causes tearing of these AC, acromioclavicular, or CC, coracoid clavicular ligaments, and this causes the shoulder to pop up, and you see this deformity on this picture here. There's different grades of this, 6 different types of these injuries. Usually the grade 1 or type 1 and 2 can be treated conservatively. Type 3 is dependent on how bad of the displacement is, as you see in that middle photo. As you're getting from greater than grade 3, those typically need surgery. Surgery can be done 2 ways. One is usually with some sort of soft tissue graft to help recreate those ligaments as seen on the picture on the left. Or sometimes if there's any associated fracture, we have to use a plate called this hook plate that goes under the acromion, stabilized with screws to help reduce the joint. That hook plate usually has to be taken out after about 3 or 4 months. And recovery from this and returning to contact sports is typically about 6 months. You can also have a clavicle fracture. This is one of our patients as well on the left, and you can see how we treated him non-operatively, and he was able to remodel that and to heal it. As you see here, some of the healing bone. Sometimes you have a patient that the 2 ends are too far apart, and we have to use a plate and screws to hold that together. And typical healing time for this is about 3 months. It's a little bit quicker actually when we do surgery because we can mobilize the fracture and mobilize the shoulder sooner, which sometimes people like. But if we don't have to do surgery and then the bones are well aligned, as in the top left picture, we can certainly treat that without surgery and just give it time to heal. Elbow injuries can happen as well. This is a dislocated elbow on the left, usually from falling on your outstretched arm, and it sends the force posteriorly to the back. Those will typically can be reduced and oftentimes don't need surgery. This picture here is of the radial head where there's a common fracture as well, and those are usually treated non-operatively. The only downside to these injuries, I guess one of the downsides, is the resulting elbow stiffness. The elbow is very sensitive to joint injury, and although everything may heal, sometimes people will lose a little bit of their motion. And so, although you may not need surgery, you still may have some complications. Skier's thumb, named for this tear of this thumb ligament injury. As you fall down, your thumb gets bent to the outside and it can result in a tear or fracture. Now, typically small tears can be treated with casting or bracing. and surgeries reserved for larger fractures, or if we try to treat a ligament injury without surgery and then 3 or 4 months later the thumb is still unstable, those will be stabilized with surgical treatment. The back and neck also can have some minor injuries from small falls, or but can also cause some very severe injuries and paralysis from damage to the spinal cord. But don't forget just the typical, shoveling the snow, which you sometimes think can be an easy, activity, or, something that has to be done. But we have to keep our good techniques, and that's, bending from the hip and the knees, not leaning over, and not trying to lift real heavy snow and, sling that forward, which can often cause shoulder problems as well. So we're definitely seeing a lot of these injuries now. We've been lucky so far not to get hit with too much snow, but it's something to be, very cautious about. Concussions can also happen as well from these falls, especially going at high speed. So it's very important to wear the right protective gear, and not just any helmet, but one that is appropriately fit. So what to look for concussions is blurred vision, dizziness, confusion, loss of consciousness, swelling, and vomiting. So an ounce of prevention, that's really what we want to talk about now, shifting towards the talk, using appropriate equipment, wearing the right protective gear, making sure you warm up and stretch before activity, seeking the proper training for the skills required for that activity. So, take frequent breaks, especially for the kids. They just want to get out there and go, and they forget to drink water or to eat. And so we don't want to, muscle exhaustion can creep up on them and pose other risks. Keep an eye on the weather. Always check the forecast, and that's looking for precipitation and snow, or even sudden drops in the temperature where you're not appropriately clothed. Don't go alone. That's one of the most dangerous things you can do, because if you do get hurt, you may not be able to get help on your own. So stay close to one another to be able to react quickly if there's an accident. Do your warm-up exercises. Muscles get tighter when the temperature drops and your blood vessels contract. And so your warm-up routine should consist of proper stretching of the arms, legs, and back. Arm circles, small jogging in place to warm up the legs, simple squats, getting the back limber by twisting, rotating around your core, or, side to side bends as well. Follow the proper technique. A lot of injuries happen because the athlete didn't have the right form. So again, spend time with an instructor, learning the proper technique to avoid these injuries. Even learning how to fall can save you from a bad injury. And one thing we talked about with the young lady that I showed earlier was just knowing when to roll off a sled that may not be stopping appropriately. Don't push beyond your experience level. Recognize your own limitations. Know your terrain, and we'll talk about that. But on these big slopes, and the courses have set up certain boundaries for a reason, and it's very easily to go from the easy green slopes to a blue or black diamond without if you're not paying attention. So wear appropriate clothing, and that's wearing long sleeve shirt or vest, properly insulated jackets, waterproof outer shells, insulated gloves, to prevent any frostbite injuries. But also make sure that your clothes are loose fitting so your movements aren't constricted, and also choose breathable and synthetic fabrics to allow the release of heat that's trapped inside. Again, as we mentioned, be familiar with the surroundings, avoid the crowded areas, don't wear headphones that can affect your ability to hear others around you, and always scan the area around you. So that's kind of our short and sweet talk there about various winter injuries. We can make an appointment at any one of our offices currently located in Michigan and Southfield, Novi, and Brighton. Area code 248-349-7015. Check us out at my Instagram there, as well as the Core Institute page for frequent updates on links to these talks and various other topics. We're happy to open it up to any questions. So I think it's different depending on what you're doing. If you're skiing, they tell you to fall backwards. If you're snowboarding, it's more kind of to the side. But if you're just kind of walking out, you hit black ice. I don't know that it's something you can necessarily prevent because it happens so quickly. But I would say the easiest thing to do is to kind of think about bringing your head forward so that you don't hit back, and then maybe kind of doing like a tuck and roll type thing with your shoulders, so that the people that get in trouble tend to reach out, and then that's how you fall and you get a wrist fracture or elbow fracture or even a shoulder dislocation from there. But I would say if you can try to fall to the side, keep your head up, that avoids hitting your head on any concrete and then trying to protect your shoulders. That's a good question. Typically, shin splints and stress fractures come up from excess training. Shin splints really involve more kind of the muscle tightness. And so we advise more of a stretching program and gradual ease into activity for the shin splints. Whereas stress fractures will be a more constant pain, and pain that doesn't go away with activity, or pain that dramatically worsens with activity that you can't push through. I actually just treated a lady over the weekend as I was on call at the hospital. She had been having some pain in her hip that was misdiagnosed somewhere, and when she fell, ended up having a fracture. She's only 40 years old. That's not typical for a 40-year-old to have a hip fracture. And so, we did have to fix her hip. But certainly, if you're having those types of symptoms, please seek the appropriate care with your orthopedic surgeon. There's certain things we need to work up, like your calcium and vitamin D levels. Possibly getting an MRI. Keeping non-weight bearing, and so be aware of those types of symptoms when trying to differentiate between the two. I think it's a good idea to at least assess it. Is it something where you just have some, ligamentous laxity, and that's just part of your normal anatomy? And it's something that we can, maybe re-educate or rehab your muscles to help control that? Or is it something that's causing a bigger problem that could lead to further arthritis or damage of the labrum and cartilage? It's something that may be able to be prevented with either physical therapy or a surgical procedure. So some people are naturally loose jointed, but sometimes that can be a problematic thing long term. So we'd certainly like you to at least get it checked out, and we develop a plan for you. So when an injury first happens, the rule of thumb is to definitely ice for the first 24 to 48 hours. And that helps decrease the inflammation to the site and reduce the swelling, along with any Motrin or Tylenol, depending on your medical, comorbidities and contraindications with any other medications. After that, we do tend to like to use heat, especially to warm up a joint and to get it moving. That'd be in the morning. And then ice as needed throughout the day or later at night, depending on how the joint is reacting. So that's a good question. There's three different grades of ankle sprain, and certainly the higher the grade, the longer it can take to heal. One thing that happens often with ankle injuries is that it is sore and painful for the first couple weeks, and then the pain will go away. But that doesn't mean that you've properly rehabbed that ankle injury. So ankle sprains are very important to obtain the appropriate rehab. Why is that? Because When you sprain your ankle, you're stretching out your ligaments, but you're also stretching out the tendons and the muscles, as well as the nerve fibers around the ankle. And so the ligaments that get sprained or partially torn will scar in, but we also need to retrain the muscles for what's called dynamic control, dynamic stability of the ankle. That controls when your ankle is in a certain either sport activity or even simple thing as walking off a curb or walking down the stairs. You want the muscles all around the ankle to be working properly together to control the ankle in space. And some of that also comes from a nerve feedback. So as the nerves are damaged from the sprain, we want to re-educate and retrain those nerves through proprioceptive training, knowing where your ankle is in space, joint kind of the sensory nerves inside the joint that tell it how to act, tell the muscles how to react. So if you're still having trouble a year later, it may be that you need to get appropriate therapy program, or maybe even an MRI to see what else is happening. Did your ankle sprain cause some arthritis that's still lingering? And what else can we do to treat that for you? So, growing pain can be from just a simple muscle pull, which can be rehabbed and rested and strengthened. It could be a sign of hip arthritis if you're having growing pain, and depending on your age. It could be a sign of a labral tear, in the cartilage around the socket of the hip, or it just could be some hip flexor, strain. So, multiple things can cause that. That's where having some X-ray imaging, the age of the patient, their activity level, when does the pain come with certain movements and activities, helps us to kind of figure out what exactly is going on. But if it's something that, hasn't gotten better with some rest and, re-strengthening, a little bit of therapy, some anti-inflammatories, definitely please come in and we can assess it for you. Very good question, because sometimes the emergency room or other non-orthopedic physicians can use them interchangeably. But what I would say is a shoulder dislocation is when the actual ball goes out of the socket and that needs to be put back in place. You can have what's called a subluxation where it partially goes in and out of socket. But that's what I would refer to as dislocation. The shoulder separation is typically what we talked about before, which involves the AC joint at the top of the shoulder. So not the actual joint itself, but where the collarbone and the shoulder meet, the AC joint. That's what we refer to more as the AC separation. And those have different grades, as we discussed before.